Thanks a lot, Peter, for the introduction. Good afternoon, everyone. As said, my name is Bart Verreydt. I've been active in the healthcare industry for the last 10 years or so, and I've been working for companies like 3M, Kimberly-Clark Healthcare, and then later on Halyard Health and Owens & Minor. But I switched careers and I joined Iristick about a year ago. And at Iristick, we manufacture smart glasses and we also offer extended reality solutions. And so today I'm here to share with you my view on how extended reality and some wearable technology like smart glasses can help overcome some of the high-level key challenges that I see in the healthcare industry. I think everybody in the room agrees that our healthcare system, globally even, is under a lot of pressure for the last couple of years. We've seen rising chronic diseases, we've seen the aging of the population, but on top of that, there was COVID-19, and that created a lot of additional hurdles or additional challenges for the industry. So there's a backlog of healthcare procedures. We see delayed treatments, postponed surgeries. We even see the inability or the fear of patients to go and see a doctor or to go and see a hospital visit. And there's also, of course, the physical and the mental exhaustion of all the healthcare workers as a result of that. And so I've stolen a quote from Boston Consulting Group. They've done quite an extensive study on this topic, and they say, well, there's no way of going back to how the situation was before COVID. We need to reinvent ourselves. We need to adapt ourselves to a new reality, unfortunately. And only those who are successful in doing that will be the ones that will be successful for the future. On top of that, I think we all recognize that many hospitals are struggling with infrastructure cost challenges. There's limited budgets to maintain or let alone to develop the existing infrastructure that sometimes even is a little bit outdated. Many people within hospital management are looking for creative ways to increase the overall efficiency of hospital services. We see more and more a trend towards specialization into certain domains. Electronic patient file owners. And so basically, we're now trying to also automate the entire administrative process. So they visit a patient, they take a picture of the wound, they make some annotations, they add some speech to text to it, and automatically we upload that in the electronic patient file. That's the next step that we're taking. We at Iristick also have a project that is called Social in Motion, and we actually want to make sure that we can offer this technology also to the underserved people in the world. So we basically work with lots of NGOs to make sure that we can offer affordable healthcare to the poorer people in the world. And so the picture you see there is a big project that we had in Congo, where again we equip some nurses with our smart glasses, with an extended reality solution, and basically we help unlock the access to medical expertise in the more rural and remote areas. And so we help improve the primary healthcare services also in these remote villages or even in the bush, as they call it. So that's affordable healthcare. And then something that we see more and more popping up as well is digital workflow guidance. And digital workflow guidance is actually a software that helps you to break down very complex procedures or audits or inspections in individual step-by-step workflow instructions. And so we send these individual workflow instructions onto the LCD screen of the person wearing the glasses. Sometimes it's just plain text instructions, but it can also be like a YouTube-ish type of movie of 15 seconds to literally explain in a dummy-proof way, hey, this is what you need to do, this is how you do it, and then once you've done it, you just say okay, and the second step pops up, and the third, and the fourth, and the fifth, and the sixth. So it eliminates errors, it eliminates mistakes, it's a lot more traceable, and basically the wearer of the glasses has all the instructions available with a blink of an eye, literally. And then pick by vision, I think, is also important to explain to a healthcare audience, because more and more I get questions from hospitals and healthcare players to also help them with what we call pick by vision. And pick by vision is nothing else than hands-free picking and packing in a logistics environment. So I guess you all know these handheld scanning devices that every logistic operator has to scan the barcode, and then he sees what the package contains and what is the location, hallway 5, etc., etc. Well, you no longer need that. You just wear the glasses, you look at it, and within quarter of a second, it tells you this is the package, location number XYZ in hallway number 5. We even have softwares that tell you the shortest route towards the hall where you need to drop the package. So that's what we call pick by vision, hands-free picking and packing. And then the last one that I wanted to share is on artificial intelligence. So you probably all know the Bayer company. We're not working yet with their pharmaceutical division, but we are working with a division that's called crop field inspection or harvest management. So they have a lot of crop field inspectors in all areas, most remote areas of the world, where they have to inspect all the fruits and the plants that they're growing. And it's a human process, so it's crop field seasonal people, crop field inspectors that have to dress up in a sterile way and that literally manually have to inspect each plant, whether there's sunburn, a disease, a beetle, or whether it's ripe for harvesting. Very labor and time intensive. And so together with Bayer, we developed an artificial intelligence solution based on deep learning computer vision solutions. So we took that many pictures of healthy and non-healthy plants that the computer is now able to say, hey, this is a healthy plant, this is ripe for harvesting, this is a bug, this is a beetle, this is a disease, etc., etc. And so they need fewer crop field inspectors. And the crop field inspectors that they have, they just wear these glasses, they walk through the fields, through the fruits, and literally within, again, quarter of a second, they get feedback on the screen. Yes, you can harvest these tomatoes, or oh, here is a disease, here you need to spray something. So you see the numbers over there, productivity went terribly up, accuracy as well, errors came down, and we're actually rolling that out globally across 7 divisions with Bayer. And why am I mentioning this? As we speak, we are also about to launch a similar artificial intelligence solution to recognize surgical instruments and instrument trays in the sterilization department. That's a terrible pain for many hospitals. We've done lots of voice of customer, and we're starting to do some trials in the US now, and we think we can be successful in the optical recognition of surgical instruments as well. Voila, those were my 20 minutes. So I'm here on behalf of Iristick. So if you have any interest in extended reality or in smart glasses, feel free to reach out, and we are more than happy to help solve some of the challenges in healthcare. Thank you.